Hey there, Peppery people. As I hit record just now, I really have not much of a direction for this video. The sound of everyone clicking off. Hell of a way to start a video. So something's been kind of bothering me lately, and I guess it's always been there, and it has to do with the gatekeeping, I think I'm gonna call it, of sleep disordered treatment. And I don't have a solution for it. So here's what I'm seeing, and this is globally. Just had a conversation with a super nice lady from Edinburgh, Scotland, and works in the healthcare system, and she had some similar frustrations to me. Now, this was a completely, and I want to keep this totally non-political. I know it's a difficult thing to keep things like healthcare completely non-political, but I think that this spans everyone, no matter what your beliefs are. So I do these PAP analysis through my website, AXG Sleep Diagnostics, and I see very similar problems, whether you're in the US, whatever part you're in, whether you're in Canada. I've done several appointments with people in Saudi Arabia, Australia, several recently in Scotland, the UK, Denmark, some in Spain, some in Portugal, literally all over the place. Mexico, another one. Some of the problems are when people have difficulties with their PAP therapy. So some simple changes such as, hey, I really have exhausted this CPAP. I'd really like to try something like a bi-level. And they're met with all kinds of resistance. This resistance is, well, I don't think that's right for you. I don't think you need a bi-level because your numbers on APAP look super stellar. So I'm looking at their Oscar data with these people. It does not look good. It does not look stellar. Yes, their AHI numbers are magnificent. But as we know, if you're a cult member here, which by the way, I have a bone to pick with some of my cult members. The cult of Lanky. I can't remember what we called it. I know it was 5C, Christian Cat Channel Cult something. I'm sorry, I'm a really bad cult leader. But as we know, looking at Oscar, it doesn't tell the whole picture unless you're looking at all the actual waves. And now doctors don't look at that. And so they're just like, no, your numbers look good, you're good, you should be good. And if it's not good, it's all in your head, or give it time. Those are the kind of gaslighting things that people will say. So with that, from all around the world, I've done several physicians, several nurses, people in healthcare that are kind of in this field, and they are massively frustrated by the same gaslighting that everyone else receives, everyone who's not in the medical field. The gaslighting, I would say, is just very prevalent. So I don't have the answers for this, but I will tell you. By the way, I'm sitting on, someone thought this was, I thought I'd sit here. It's like a throne. This is my wife's Pilates chair, like an exercise machine. But someone thought I was so feebed out from COVID that it was a walker. Hey, I may look like hell, but I'm a strapping young lad still, at least in my head. We're supposed to be at ease, so fireside chat. So everyone sip your coffee. So even the physicians are having these problems, and now you can get political and say, well, it's because healthcare is not nationalized. But even in nationalized healthcare systems, this is very much a problem. Or you can say, well, it's because you're in the US and goddamn greedy insurance companies. But like, they're trying to protect their bottom line, and it just jacks the price up and creates more obstacles to getting like a bi-level in this situation. So no matter what system you're in, there's problems. There's red tape that you have to get through. But in all of them, the one thing that seems to be consistent is a lack of advocacy on the part of the physician, either from ignorance, and I don't mean that in a bad way. I mean, I'm certainly ignorant about all kinds of things. Everyone has stuff you simply just don't know. So ignorance, some willfully, some not, some are just overworked. I'm really not trying to bash physicians, I promise you. Physicians are great, they know a lot about a lot of things, but there's some stuff that they don't know about, and they don't know about it until they know about it. And I think that comes from the top. So in the US, that would be like the AMA or the AASM, Sleep Medicine, American Association of Sleep Medicine. I'm sure there's global ones, but the AMA, American Medical Association, there needs to be an education about this stuff. It's very simple stuff. And I don't know if that's creating a whole new industry, which is like my business, just text people who look at waves, offering suggestions. Those get to the doctor, and you just spit those out. things like Sleep HQ, Nico, if anyone's familiar with his channel. Sleep HQ is a platform. You can go on there, check people really rapid fire quick, say, hey, I think you need to try this, you need to try that. Take it off the doctor's plate entirely, but that needs to be recognized by systems, and they need to trust the tech like, hey, I really think Bob needs a bi-level. So I'm really curious what you guys think. Don't get political, I'm telling you, this is a cult. You gotta keep politics out of it, you gotta embrace the cult. And speaking of embracing the cult, you guys didn't watch my most recent video on Lanky's cat channel. Has to do with what's better, scuba diving or snorkeling. It's riveting, trust me. If you haven't watched it, you're kicked out of the cult. In the future, I don't have enough members, so just maybe some form of re-education, you know what I mean? We need to let that breathe with a coffee sip. Used to have a coworker that did that all the time. Hella annoying. So no matter where you are in the world, I would definitely like to hear from you on this one. In the comment section, if you don't know where it is, it's down below. What have your experiences been if you're trying to change to a bi-level? What did you do to get around it? And finally, the big one, what do you think we need to do to replace it or fix it? I want your honest opinions. I am going to offer mine right now though. Maybe this is getting political, I don't know. It does actually serve well if I'm talking about the sponsor of this video, so they'll like it. Let's just go ahead and do it. What the heck? I really think that healthcare should be, I hate insurance. My business is based around, I don't like insurance. They're a pain to deal with. It makes things cost way more than they need to. It forces me to do a ton of extra work simply to get paid when the person could just go, hey, I want you to do this. And I go, cool. Put your credit card number in, boom, done. And then I do my service. I don't have to do the billing. I don't have to do all that other stuff. It's way overcomplicated, and it requires me to have staff, which is why I stopped doing it. So this is global for all of healthcare, and I know this is too simplified, but for just simple doctor's visits, whether they're specialists, whether it's your sleep medicine doctor, whether it's your primary care doctor, whether you're going in for just lab draws, I would also love it if those were just pay at the time of service. You whip out your credit card, and that's it. Now, those that have a difficult time affording it, I know you could do, like in the US, you have food stamps, EBT cards. You could supply people with medical versions of those, simply used for medical expenses. Fine, whatever. I'm not advocating for that. I'm not saying you shouldn't, but just for those that are gonna go, well, what about people that can't afford it? I totally get it. Yeah, you want people to be able to have access to healthcare for just simple things like that. Totally get it. Then you have things such as surgeries. Now maybe have insurance for surgeries, for hospital stays, stuff like that. But the simple stuff, let's get back to the days where you'd go to the doctor, you'd trade him a couple chickens for some leech therapy to get your humors back in order. Something like that. Okay, now I kick it off to you. My bad. And in that keeping, if you like to buy stuff out of pocket, insurance is causing you way too many hassles. And you're like, oh, excuse me, Jocelyn. What kind of hassles? Hassles about just getting crap. If you have problems with that, CPAP Supplies is 100% right for you. You just want to pay out of pocket. You want to get your stuff. You want to get out of there. You want to buy a machine. You want to buy a mask. You want to buy extra tubing. You want to buy some CPAP mask wipes. You want to buy a VCOM. You want to buy the new Nasal Pillow Solo that's coming out. By the way, check the description box on how to order that ahead of time. You just want to pay cash. You can use discount code LeftySummer. You can use discount code Lefty20. You can save either 20, 25% off, get loyalty reward program points, but you don't have to deal with insurance. You don't have to deal with doctors. Oftentimes you can get these masks without a prescription required. And who says it has to be an actual prescription, you know? You know what I mean? Bob Johnson, MD. I would never advocate for that. Don't do that. Don't do that. Do check out the sponsor of this video, cpapsupplies.com. Get some stuff there. All right, I leave it up to you guys. What do you guys think of this problem? What do you think we should do about it? What's the best solution? I'm really curious to hear from all you folks. You guys all have very different life experiences, probably have all kinds of different political opinions on this, but realistically, what's gonna work? US system doesn't seem to be working. The Canadian system doesn't seem to be working. Whatever they got in Australia doesn't seem to be working. Whatever they have in Saudi Arabia doesn't seem to be working. Canada, Europe, none of those places, the systems seem to be working. Denmark, we also have Finland and Norway, as well as Sweden. Very similar, different types of political environment, different healthcare systems, not working anywhere. So what do we do about it? How do we change this? Really interested in hearing from you. Let me know in the comments section. I really do appreciate it. Sorry for the rant, I guess. This is like a kind of a lightweight rant on my walker here. Thanks for watching. Bye. Clean your stinky mask with some Mask Bright, available at Amazon. And time for an extra thick thanks, buddy, to my top level supporters: Doug Toombs, Jason Georgiades, Patricia Espelong, Stuart Hetherington, Alan Liu, Chung Chu Chen, Edward Steiner, and Teddy Stegman. Probably messing up the pronunciation, but it is what it is. I'd like to say thank you also to these people, you get a shout out, as well as barely those other people. Screen, but still appreciate the support. Thanks for watching.